Next, I think we have one of our representatives from the Miracle of Love bus. Can y'all give it up for the Miracle of Love? Welcome, Wyatt. Everybody say, welcome, Wyatt.
Welcome, Wyatt.
Okay, so I did not have preparation for this. I was told I was talking literally as I pulled in this afternoon or this morning. So I don't have any prepared speech, and I had to follow him. Sympathies are appreciated. All right, so my name is Wyatt. I am a community outreach coordinator with Miracle of Love. What Miracle of Love is, we are an HIV/AIDS agency that works with prevention as well as ongoing case management and treatment for people who've been diagnosed with HIV and AIDS in the Central Florida community. What we do in our prevention department, or what we're doing here, is we do an INSTI test. It's a 1-minute test for HIV. We poke your finger, take a little bit of blood, and we have your instant results, whether you're reactive or non-reactive, within a minute. If you were to, say, come back as a reactive test, we would link you to care immediately. So we would connect you with case management to make sure you got medical treatment, as well as mental health treatment, dental, and other services on the medical side. And then in addition to that, we would hook you up with our housing department, who may help you with your rent, utilities, etc. Also, we offer targeted outreach for pregnant women. So if you are a high-risk pregnancy, whether you're HIV positive or not, we have a program that would be able to help you out with your medical treatment and getting you some of your supplies for your baby. We have a baby shower and a little shopping thing within the department where you can go pick out things for your upcoming birth. Why is HIV important in Central Florida? I have some scary numbers. In Orlando in 2016, there were 11,962 people living with HIV. In 2016, we diagnosed 652 new people with HIV. Of those cases living with HIV, 73% are men, 27% are women. 38% of those are African American, 28% are Hispanic or Latin, and 31% are white. HIV is not gone. HIV is still with us today. We are able to prevent it from turning into AIDS, but it's still here. It's kind of scary because Florida's #1 in the nation for new HIV infections. And Orlando's #3 in the state of Florida. The stigma that carries with HIV prevents a lot of people from coming in to get tested. Nobody wants to talk about the things that lead to HIV infection. It's uncomfortable. Trust me, I've been doing this now for almost a year, and I'm still uncomfortable talking about it, but we get past it. All we need is for people to accept the fact that HIV can happen to anyone. It only takes one time, and it can be from something that you would least expect. You didn't use protection. You did something kind of crazy, and you didn't have your insulin needle, so you borrowed somebody else's. Simple things that you may not think of can cause you to become HIV infected. But here's the good news. HIV is not a death sentence. In the 80s and 90s, if you were diagnosed with HIV, you pretty much checked into a hospice. Now, you're going to live your full life, a healthy, normal, decent life with treatment. It's just like diabetes. We can keep you going for years and years and years. I tell everyone a story about my friend who was diagnosed in 1980. He should be dead. I mean, all things considered, in 1980, there was nothing. They said, you have HIV, you have AIDS, tell your family goodbye. He's going to be 70 next year. He is undetectable. And what that means for anyone who's unaware, undetectable means his viral load is so low that he cannot transmit the virus to anybody else. And that is through the wonder of pharmaceuticals. In addition, the counseling, the education of how you protect yourself from HIV, that's been a huge impact in the state of Florida and around the country. But the biggest thing I want to just push for everybody is that HIV can be scary, it can change your life, but it's more important to know your status than to hide it from it. Because we can take care of it, you can live a healthy life, And nobody has to be the wiser. It's just like diabetes. You'll be just fine. With that, thank you.